Lameness seen under specialized circumstances, in this case ridden, but not obvious in hand or on the lunge. In this horse, perineural anesthesia of the plantar and plantar metatarsal nerves, the low 4-point block, resulted in 50% improvement. But the horse was still consistently lame on the right hind limb, on the right rein, and therefore, by the AAEP definition, remains grade 2 lame. So using the grading system recommended by the AAEP, we cannot say that the horse is showing improvement. And that's, I think, a major limitation of the AAEP system. So my 0 to 8 scale is 0 equals sound, 2 is mild, 4 is moderate, 6 is severe, and 8 is non-weight bearing, with 1, 3, 5, and 7 as intermediate grades. I can use this grading system independently under any circumstances. So at walk in a straight line, at trot in straight lines and on the lunge, going to the left, going to the right, soft surface versus hard surface. But in addition to that, I embellish my grading with a verbal description, rather as I described to you for the previous horse. And this combined system, I believe, gives greater scope for describing the spectrum of lameness that we see. So there are no specific definitions, and I find this system easy to apply consistently, recognizing that different horses adapt differently to lameness, and also that if a horse is lame in more than one limb, the grade assigned to the lamest limb may not be strictly accurate. It may appear less lame on that limb because it is lame on another limb as well. Now, some horses make it difficult for us to look at some of our landmarks. So this Arab horse with a very high tail carriage makes it difficult to look at the tuberous sacrale, makes it challenging to evaluate the hindquarters. But we can, with assistance, by placing markers on the tubera coxae, look at the relative movement of the tubera coxae. This horse had wonderful oscillation of its tail from side to side, which made the whole thing even more challenging. So I believe that there are difficulties with definitions that rely on pelvic excursion alone. So let's consider the clinical scenario of 5 horses with right hind limb lameness associated with osteoarthritis of the centrodistal joint. Horse 1 shows a mild toe drag, but obvious asymmetry of the pelvic excursion and a shortened cranial phase of the step, and is a grade 4 out of 8 lame. Horse 2 shows less obvious asymmetry of the pelvic excursion, but a much stiffer limb flight and a more obvious toe drag, but is also moderate and therefore grade 4. Horse 3 moves on 3 tracks, drifting away from the lame right hind limb, and it has a more obvious audible irregularity of rhythm, and was therefore assigned grade 5.